Today, I want to begin with a warning. One that doesn't come from social media trends or internet rumors, but from the operating room of a cardiac surgeon who has seen the consequences firsthand. Every morning, millions of people wake up and follow the same routine. It feels harmless, ordinary, even healthy. But according to leading heart specialists, one common morning habit is quietly increasing the risk of dangerous blood clots, often without any immediate symptoms or warning signs. Blood clots don't announce themselves loudly. They form silently, travel quickly, and when they strike, the results can be devastating. Heart attacks, strokes, pulmonary embolisms, and sudden loss of life. What makes this warning so important is not how rare it is, but how common this habit has become. You may be doing it right now. Your loved ones may be doing it. And most people have no idea that it places extra strain on the heart and circulatory system in the very first hours of the day. Today, we will uncover what this habit is, why cardiac surgeons are increasingly concerned, and, most importantly, what simple changes can protect your heart and your life. The early morning hours may feel calm and harmless, but inside the body, they are a period of intense physiological change, especially for the heart and blood vessels. Cardiac surgeons and cardiovascular researchers have long observed a troubling pattern. Heart attacks, strokes, and blood clots occur more frequently in the morning than at any other time of day. This is not a coincidence. It is the result of how the human body naturally transitions from sleep to wakefulness. While we sleep, the body enters a state of reduced activity. Heart rate slows, blood pressure drops, and breathing becomes deeper and more rhythmic. Blood circulation also becomes slightly slower. This is a normal and healthy part of rest. However, when we wake up, the body must rapidly switch gears, sometimes too quickly for the cardiovascular system to handle safely. One of the most critical changes that happens in the morning is blood thickening. During sleep, we lose fluids through breathing and perspiration. By morning, many people are mildly dehydrated, even if they don't feel thirsty. Dehydration reduces plasma volume, making the blood more concentrated and thicker. Thicker blood flows less smoothly through the vessels, increasing friction against artery walls and raising the likelihood of clot formation. At the same time, the body releases a surge of stress hormones, particularly cortisol and adrenaline. These hormones are designed to help us wake up and become alert, but they also raise blood pressure and heart rate. This sudden increase places extra strain on the arteries, especially those already narrowed by cholesterol plaque or inflammation. When thicker blood is pushed through tighter vessels at higher pressure, the risk of a clot forming rises significantly. Another key factor is platelet activity. Platelets are the blood cells responsible for clotting when we are injured. In the morning, platelet stickiness naturally increases. This evolutionary mechanism once helped protect early humans from bleeding injuries upon waking and moving. However, in modern life, where injuries are rare but cardiovascular disease is common, this same mechanism can become dangerous. Sticky platelets combined with thick blood and narrowed arteries create the perfect environment for unwanted clots. Additionally, blood vessels themselves behave differently in the morning. Arteries tend to be less flexible shortly after waking. This reduced elasticity makes it harder for vessels to expand when blood pressure rises. Rigid arteries are more prone to microscopic tears in their inner lining. When this happens, platelets rush to the area, and a clot can begin forming silently, without pain or warning. The body's natural circadian rhythm also plays a role. Research shows that the risk of cardiovascular events peaks between 6 a.m. and noon. This is when blood pressure rises sharply, clotting factors are most active, and circulation is under the most stress. For individuals with existing risk factors, such as high blood pressure, diabetes, obesity, smoking history, or sedentary lifestyles, this morning window becomes especially dangerous. Another often overlooked issue is sudden movement after prolonged inactivity. After lying still for several hours, blood flow in the legs and lower body slows. Standing up quickly can cause abrupt shifts in circulation. In some people, especially older adults, this can dislodge small clots that formed overnight, allowing them to travel to the lungs, heart, or brain. Cardiac surgeons frequently witness the consequences of these combined effects. Emergency cases involving heart attacks and strokes disproportionately arrive in hospitals during morning hours. Many patients report feeling fine the night before, with no warning signs. This is what makes morning-related clot risk so dangerous. It operates quietly, invisibly, and efficiently. Understanding why mornings are a high-risk period is the foundation for prevention. It explains why certain habits performed immediately after waking can either protect the heart or place it under even greater strain. The goal is not to fear mornings, but to respect the body's vulnerability during this critical transition and make smarter choices that support circulation rather than stress it. By recognizing that the morning hours are biologically primed for clot formation, we can begin to take simple protective steps. Steps that cardiac surgeons strongly encourage, and that may ultimately save lives. Among the many lifestyle factors that influence heart health, one morning habit stands out as particularly dangerous, yet it is so common that most people never question it. Cardiac surgeons increasingly warn against starting the day without proper hydration and immediately jumping into stimulants or inactivity, especially drinking coffee or tea before water and remaining sedentary right after waking. This routine, repeated daily, quietly places the body in a high-risk state for blood clot formation. After a full night of sleep, the body is already mildly dehydrated. As discussed earlier, dehydration thickens the blood and slows circulation. When a person wakes up and reaches straight for coffee or tea, without first replenishing fluids, they unintentionally worsen this dehydration. Caffeine acts as a mild diuretic, encouraging the body to lose more fluids. Even though modern studies show caffeine's diuretic effect is modest, in a dehydrated morning state, its impact becomes far more significant. Thicker blood does not flow easily. It moves sluggishly through veins and arteries, increasing resistance and allowing platelets to stick together more readily. Cardiac surgeons see the effects of this every day. Blood clots forming not because of a dramatic event, but because of small repeated stresses on the circulatory system, starting with how the day begins. Another part of this habit is remaining inactive for too long after waking. Many people wake up, sit on the bed, scroll on their phone, watch the news, or remain seated during breakfast. This prolonged stillness, following hours of sleep, allows blood to pool in the lower extremities. Reduced muscle movement means the veins are not being assisted in pushing blood back toward the heart. Slow-moving blood is one of the key conditions for clot formation. When dehydration, caffeine intake, and inactivity combine, they create a perfect storm. Blood becomes thicker, vessels are under higher pressure from stress hormones, and circulation remains sluggish. This is especially dangerous for individuals with existing plaque buildup in the arteries. Even a small clot forming on top of plaque can suddenly block blood flow to the heart or brain. Cardiac surgeons emphasize that this habit is dangerous precisely because it feels harmless. Coffee is often associated with productivity and even health benefits later in the day. Sitting quietly in the morning feels restful, but timing matters. What may be safe at noon can be risky at 6 a.m., when the body is already vulnerable. Another overlooked aspect is skipping water before medications. Many heart patients take blood pressure medicine, aspirin or blood thinners in the morning. Taking these medications without adequate hydration can reduce their effectiveness and increase irritation to blood vessels and the stomach lining. Surgeons report cases where patients believed they were protected by medication, yet their morning routine undermined its benefits. This habit also affects blood pressure regulation. Caffeine stimulates the nervous system, causing temporary spikes in blood pressure. When consumed first thing in the morning, during the body's natural blood pressure surge, this effect is amplified. Elevated pressure against stiff, dehydrated arteries increases the chance of vessel injury, which can trigger clot formation. For older adults, the risk is even greater. Aging naturally reduces the body's ability to regulate fluids and maintain vessel elasticity. Many seniors wake up already significantly dehydrated. When they add caffeine and inactivity to the mix, clot risk rises sharply. Cardiac surgeons frequently warn that what seems like a small morning comfort can have serious consequences over time. Importantly, this habit does not cause immediate symptoms. There is no pain, no warning sign, no sudden discomfort. That is why it continues unchecked for years, The damage is cumulative, slowly increasing clot risk until one day, the body can no longer compensate. Cardiac surgeons do not suggest eliminating coffee or morning rest altogether. Instead, they stress sequence and awareness. The first actions after waking should support circulation, hydration, and gentle movement, not dehydration and stagnation. By adjusting this single habit, many patients significantly reduce their clot risk without medication or complex lifestyle changes. Understanding this common morning mistake is critical, because it highlights how everyday routines, done at the wrong time, can quietly push the heart toward danger. Prevention begins not with dramatic changes, but with smarter choices made in the first moments of the day. What makes this morning habit especially dangerous is not just that it increases risk, but that it does so silently. Blood clots rarely form with pain, noise, or immediate symptoms. Instead, they develop quietly, layer by layer, until one sudden moment changes everything. Cardiac surgeons often describe clots as invisible threats, and this particular habit creates the ideal internal conditions for them to form without warning. To understand how this happens, it's important to look at the three classic conditions that promote clot formation, known in medicine as Virchow's triad: slowed blood flow, thickened blood, and vessel wall injury. This common morning routine activates all three, often within the first hour after waking. The first trigger is sluggish circulation. After several hours of sleep, blood flow naturally slows, especially in the legs and lower body. When a person wakes up and remains seated, scrolling on a phone, watching television, or sitting through breakfast, the muscles that normally help push blood back toward the heart stay inactive. Without this muscular pumping action, blood begins to pool in the veins. Slow-moving or pooled blood gives clotting factors more time to interact, increasing the chance that a clot will begin to form. Next comes blood thickening, which significantly accelerates the process. Overnight dehydration reduces plasma volume, making blood more concentrated. When morning hydration is delayed and caffeine is consumed first, blood viscosity increases further. Thick blood moves sluggishly and places more friction on vessel walls. This friction irritates the inner lining of blood vessels, making them more likely to attract platelets. Platelets play a crucial role here. In the morning, platelet activity is naturally elevated. This means they become stickier and more eager to clump together. Under normal circumstances, this helps stop bleeding. But in thick, slow-moving blood, platelets may begin sticking together unnecessarily. Over time, this clumping can evolve into a small clot that forms quietly along the vessel wall. The third component, damage to the vessel lining, often happens on a microscopic level. Sudden spikes in blood pressure caused by stress hormones and caffeine place strain on arteries that may already be stiff or inflamed. Tiny tears or rough patches can form inside the vessel wall. When platelets detect these irregularities, they rush to the site as if responding to an injury. This response is automatic and silent, but it can initiate clot development. What makes this process especially dangerous is that the body gives no early warning signs. There is no pain receptor inside blood vessels to signal that a clot is forming. A person can feel perfectly fine while a clot slowly grows. Cardiac surgeons frequently hear patients say, "I felt normal that morning," even hours before a heart attack or stroke. As the clot grows, it may remain attached to the vessel wall, partially blocking blood flow. In some cases, it breaks free and travels through the bloodstream. If it reaches the heart, it can trigger a heart attack. If it travels to the brain, it can cause a stroke. If it lodges in the lungs, it can result in a pulmonary embolism. These events appear sudden, but the groundwork was often laid silently over days, weeks, or years, starting with daily habits. This habit also interferes with the body's natural clot-dissolving mechanisms. The body produces enzymes that help break down small clots before they become dangerous. Dehydration and poor circulation reduce the efficiency of these enzymes. As a result, clots that might have been harmlessly dissolved are allowed to persist and grow. Another hidden factor is inflammation. Morning dehydration and caffeine-induced stress can increase inflammatory markers in the blood. Inflammation makes blood vessels more reactive and increases platelet sensitivity. Chronic, low-grade inflammation further encourages clot formation without noticeable symptoms. Cardiac surgeons emphasize that silent clot formation is especially common in people who believe they are mostly healthy. You don't need severe heart disease for this process to begin. Mild high blood pressure, slightly elevated cholesterol, occasional smoking, or long periods of sitting are enough to create vulnerability. Over time, the body adapts, until one day, it can't. The danger lies not in one single morning, but in repetition. This habit, repeated daily for years, compounds risk. Each morning adds a small layer of stress to the circulatory system. Each day allows microscopic clots or vessel damage to accumulate. Eventually, the balance tips. Understanding how this habit silently triggers clot formation is empowering. It reveals that prevention is possible, not through fear, but through awareness. When you recognize that clots often begin quietly, you also realize that small intentional changes made early in the day can interrupt this process before it turns deadly. This knowledge is why cardiac surgeons are so vocal about morning routines. They know that the most dangerous threats to the heart are often the ones we never feel coming. One of the most dangerous myths about blood clots is the belief that they only affect people who are visibly sick or already diagnosed with heart disease. Cardiac surgeons consistently warn that many of their most serious cases come from patients who believed they were healthy. Understanding who is at highest risk is critical, because vulnerability often exists long before symptoms appear. Age is one of the strongest risk factors. As we grow older, blood vessels naturally lose elasticity and become stiffer. This makes it harder for arteries to expand and contract in response to changes in blood flow and pressure. Aging also affects the body's ability to regulate hydration. Older adults tend to wake up more dehydrated and are slower to feel thirst. When combined with poor morning habits, this creates ideal conditions for clot formation. However, age alone is not the only factor, and younger individuals are not immune. Sedentary lifestyle is a major, often overlooked risk. People who spend long hours sitting, whether at a desk, in a car, or in front of screens, develop slower circulation over time. Even those who exercise regularly can be at risk if they remain inactive for most of the day. Overnight inactivity followed by a sedentary morning routine further slows blood flow, especially in the legs. This increases the likelihood of deep vein clots that can later travel to the lungs or heart. Dehydration risk is higher in many healthy individuals, particularly those who drink caffeine or skip water throughout the day. Athletes, busy professionals, and people in hot climates often underestimate fluid loss. Chronic mild dehydration thickens the blood and increases clotting tendency. When the morning begins without rehydration, this risk becomes even more pronounced. High blood pressure is another silent contributor. Many people live with elevated blood pressure for years without knowing it. Morning is when blood pressure naturally spikes. If someone with undiagnosed or poorly controlled hypertension follows risky morning habits, the strain on blood vessels intensifies. Microscopic vessel damage becomes more likely, triggering clot formation even in people who appear fit and energetic. Blood sugar imbalance also plays a significant role. Individuals with diabetes or prediabetes are at higher risk because elevated glucose levels damage blood vessel linings and increase inflammation. But even those without a diagnosis may experience insulin resistance due to poor diet, stress, or lack of sleep. These metabolic changes make platelets more reactive and blood more prone to clotting, especially in the morning. Smoking and vaping dramatically increase clot risk, even in younger individuals. Nicotine constricts blood vessels, increases heart rate, and makes platelets stickier. Many smokers combine nicotine use with coffee first thing in the morning, compounding the effects. Cardiac surgeons frequently report clot-related events in patients who believed occasional smoking or vaping was harmless. Hormonal factors also matter. Women using certain hormonal contraceptives or hormone replacement therapy may have an elevated risk of clot formation, especially when combined with dehydration, inactivity, or smoking. Pregnancy and the postpartum period further increase clot risk due to natural changes in blood clotting mechanisms. Family history is another critical risk factor. Genetics influence how the body handles cholesterol, inflammation, and clotting proteins. Some individuals inherit conditions that make their blood clot more easily, even if they have no symptoms. Without awareness, daily habits can unknowingly activate this genetic vulnerability. Sleep quality also affects risk. Poor sleep, sleep apnea, and irregular sleep schedules increase inflammation and stress hormone levels. People who wake up exhausted or stressed already start the day in a physiologically strained state. Adding harmful morning habits amplifies clot risk significantly. What makes all these factors dangerous is that they often overlap. A person may be mildly dehydrated, slightly overweight, under chronic stress, and sitting too much, yet still consider themselves healthy because they have no diagnosis. Cardiac surgeons emphasize that blood clots rarely result from one cause. They form when multiple small risks quietly accumulate. Feeling healthy does not equal being protected. Many clot-related events occur in people who had no prior warning signs. That is why awareness matters more than fear. Recognizing personal risk allows individuals to take preventive action early, before a clot forms. This key point reinforces a crucial truth: blood clot risk is not reserved for the elderly or the ill. It exists on a spectrum, and everyday habits can push someone closer to danger without them realizing it. Understanding who is at risk is the first step toward choosing safer behaviors, especially in those critical morning hours when the body is most vulnerable. After understanding the risks, the most empowering message from cardiac surgeons is this: protecting your heart does not require extreme diets, expensive supplements, or complicated routines. In fact, some of the most effective protective steps take only a few minutes each morning. These small changes work with the body's natural rhythms instead of against them, helping reduce blood clot risk right when the body is most vulnerable. The first and most important change is hydration before stimulation. After waking, the body urgently needs fluids. Drinking 1 to 2 glasses of plain water within the first 10-15 minutes helps restore blood volume, reduce thickness, and improve circulation. This single action alone can significantly lower clot risk. Water helps blood flow more smoothly through vessels, reduces friction against artery walls, and supports the body's natural clot-dissolving enzymes. Only after proper hydration should caffeine be introduced. Next is gentle movement immediately after waking. This does not mean intense exercise or a full workout. Simple actions, such as stretching, walking around the room, light yoga, or a few minutes of slow pacing, activate muscles that assist blood flow back to the heart. Movement prevents blood from pooling in the legs and reduces stagnation in veins. Cardiac surgeons emphasize that even 5 minutes of movement can dramatically improve circulation after sleep. Another critical change is delaying caffeine intake. Waiting 30 to 60 minutes after waking before drinking coffee or tea allows the body's natural cortisol rhythm to stabilize. This reduces sudden spikes in blood pressure and heart rate. When caffeine is consumed after hydration and light movement, its negative effects on blood viscosity and pressure are significantly reduced, while its benefits remain. Breathing also plays a surprisingly powerful role. Slow, deep breathing for just a few minutes in the morning helps regulate the nervous system. Controlled breathing lowers stress hormone levels, reduces inflammation, and improves oxygen delivery. This calming effect supports healthier blood vessels and reduces the likelihood of platelet overactivation. Cardiac surgeons increasingly recommend breathing exercises as part of heart protective routines. Taking medications correctly is another key factor. For individuals prescribed blood pressure medication, aspirin, or blood thinners, taking them with adequate water is essential. Water ensures proper absorption and helps prevent irritation to blood vessels and the digestive system. Skipping water can reduce medication effectiveness and strain circulation during a critical time of day. Nutrition matters too, but timing is everything. A light, balanced breakfast that includes fiber, healthy fats, and protein supports stable blood sugar levels. Sudden blood sugar spikes increase inflammation and clotting risk. Foods like oats, eggs, nuts, seeds, yogurt, and fruit help maintain vascular health. Avoiding heavy sugary breakfasts reduces stress on the cardiovascular system in the early hours. Another protective habit is avoiding prolonged sitting in the first hour of the day. Even if work requires sitting, breaking up that time with short standing or walking intervals keeps blood moving. Cardiac surgeons advise setting a mental rule: no sitting for more than 20-30 30 minutes without brief movement, especially in the morning. Managing stress early in the day is equally important. Many people begin mornings with alarming news, emails, or social media. This triggers a stress response that raises blood pressure and heart rate. Starting the day calmly, with silence, light stretching, or positive focus, helps reduce physiological strain and supports healthier circulation. Consistency is what turns these simple actions into protection. One good morning helps, but daily repetition creates lasting benefits. Over time, these habits reduce inflammation, improve vessel flexibility, and lower overall clot risk. Cardiac surgeons often tell patients that prevention is not about perfection, it's about patterns. Perhaps the most powerful aspect of these changes is that they restore control. Blood clots often feel sudden and unavoidable, but many are influenced by daily choices. By adjusting how the day begins, individuals can dramatically shift their risk profile without fear or complexity. In the end, cardiac surgeons agree on one message: the morning is not just the start of your day, it sets the tone for your heart's safety. Small intentional actions taken in those first moments can protect circulation, reduce silent clot formation, and support a longer, healthier life.